Japan is known for having the highest number of people living beyond 100 years of age. But what is even more remarkable is that many Japanese adults maintain strong, functional legs well into their 70s, 80s, and even 90s. In contrast, according to global health reports, most people in Western countries begin losing leg strength after the age of 50. This loss leads to difficulty standing up from chairs, climbing stairs, walking long distances, and most dangerously, an increased risk of falls, the leading cause of loss of independence in old age. But if the Japanese can maintain their leg strength for so long, it means there is a method, and that method can be learned. Today, we will explore 6 simple exercises commonly practiced in Japan that help preserve leg strength, balance, and mobility even after the age of 60. But before we begin, please tell us through the comments your name, your age, and the city from where you're watching our content. Exercise 1. Sampa. This is a slow, meditative walking technique practiced in Japan to enhance both physical and mental health. It emphasizes full awareness of each step, heel, midfoot, and toes. Studies involving Japanese adults over 65 showed significant improvements in blood circulation, balance, and fall prevention after 3 months of regular practice. To practice Sampa, walk very slowly in a safe, open space such as a hallway. Move 4 to 5 times slower than your normal walking speed. Focus completely on how your foot touches the ground with each step. Breathe deeply, taking 1 breath every 3 steps. Exercise 2. Resting squat. The resting squat is one of the most common postures in traditional Japanese daily life. Unlike Western cultures that rely heavily on chairs and sofas, Japanese people often rest in a deep squat position. This posture is considered more natural for the human body and helps maintain mobility over time. The resting squat activates multiple muscle groups at once, including the quadriceps, hamstrings, glutes, and core muscles, all while the person is simply resting. Research from the University of Tokyo found that adults over 70 who regularly practiced resting squats had leg strength comparable to individuals in their 50s. To perform the resting squat, stand with your feet shoulder-width apart and slowly lower your body until your hips are close to the ground. Keep your heels flat on the floor and your spine in a neutral position, not overly arched or rounded. The core should be gently engaged to protect the lower back. For beginners over 60, it is recommended to hold onto a stable object, such as a chair or table, and maintain the position for 20 seconds. Gradually increase the duration until you can comfortably hold the squat for 2 to 3 minutes without support. This posture not only strengthens the legs, but also improves circulation, supports digestion, and develops mental tolerance to mild discomfort. Common mistakes include lifting the heels or rounding the lower back, both of which reduce benefits and increase joint strain. Practicing this squat 3 to 5 times a day can significantly improve ease of movement within a few weeks. Exercise 3. Standing on one leg. Balancing on one leg is a simple but highly effective exercise widely practiced by older adults in Japan. It strengthens the stabilizing muscles of the ankles, knees, hips, and core, muscles essential for preventing falls. Many Japanese incorporate this exercise into daily routines, such as while brushing their teeth or waiting in line. A long-term study showed that elderly individuals who practiced single-leg balance daily reduced hip fractures by 60% and falls by 40%. To perform the exercise, stand near a wall or sturdy object for support. Shift your weight onto one leg and lift the other foot slightly off the ground. There is no need to lift the leg high. Keep your shoulders relaxed and your gaze fixed on a point in front of you. Begin by holding the position for 10 to 15 seconds with support, alternating legs for 3 repetitions. Over time, aim to hold for up to 60 seconds without support. This exercise also improves reflexes and neural coordination, helping the body respond faster if you stumble. Practicing for just 5 minutes daily can lead to noticeable improvements in balance and confidence. Exercise 4. Wall squat. The wall squat is a safe and effective isometric exercise widely used in Japan for strengthening the legs without joint impact. It targets the quadriceps, glutes, and core. To perform it, stand with your back against a wall and your feet about 12 inches away. Slide down until your knees form roughly a 90-degree angle. Keep your knees aligned with your toes and breathe normally. Begin by holding the position for 15 to 20 seconds, performing 3 sets daily. Gradually increase the hold time to 60 seconds. You should feel muscle fatigue but no knee pain. This exercise also builds mental resilience by teaching the body to tolerate controlled discomfort. For added difficulty, place a cushion between the knees and gently squeeze during the hold. Exercise 5. Kiba Dachi. The Kiba Dachi, known as horse stance, is a traditional posture used in Japanese martial arts. It is an isometric exercise that builds strength without joint impact, making it ideal for people over 50. This stance strengthens the thighs, hips, glutes, adductors, and core, creating a stable foundation for the body. A study published in the Journal of Physical Therapy Science found that elderly participants increased leg strength by 24% after 12 weeks of practicing this posture. To perform the horse stance, stand with your feet about 1.5 times shoulder width apart. Bend your knees and lower your body as if sitting on an invisible chair. Keep your spine straight and your weight evenly distributed between both legs. Beginners should hold the position for 10 to 15 seconds, performing 3 sets daily. Gradually increase the time to 60 to 90 seconds as strength improves. You should feel a controlled burning sensation in the thighs, but no joint pain. Avoid letting your knees move past your toes or keeping your hips too high, as this reduces effectiveness. This exercise is not recommended for people with acute knee issues, but it is generally safe for most adults over 50. Exercise 6. Heel raises. Heel raises strengthen the calf muscles, which play a crucial role in walking, balance, and blood circulation. In Japanese culture, calves are often called the second heart because their contractions help pump blood back to the heart. To perform heel raises, stand with your feet shoulder width apart. Slowly rise onto your toes, pause for 1 to 2 seconds, then slowly lower your heels back down. Beginners over 60 should start with 2 sets of 15 repetitions, using support if needed. Progress to 3 sets of 20 repetitions as strength improves. The movement should always be slow and controlled. Avoid using momentum or moving too quickly. For progression, perform the exercise on one leg or on a step to increase range of motion. Regular practice improves circulation, reduces ankle swelling, and increases endurance for walking and standing. Bonus exercise, Zazen meditation. Zazen meditation is a traditional Japanese sitting meditation that focuses on posture, breathing, and present moment awareness. Practiced for centuries in Zen Buddhism, Zazen is not about clearing the mind, but about observing thoughts without attachment. The practitioner sits with a straight spine, legs crossed or on the heels, hands resting gently in the lap, and eyes half open, gazing downward. Breathing is slow, deep, and natural, with attention placed on each inhale and exhale. Regular practice of Zazen helps calm the nervous system, reduce stress, improve mental clarity, and develop emotional resilience. For older adults, Zazen is especially beneficial as it enhances concentration, improves posture, and promotes a deep sense of inner stability and balance. Even practicing for 5 to 10 minutes daily can lead to noticeable improvements in mental peace and overall well-being. These simple practices reflect a key principle of Japanese longevity: consistency over intensity. Performed daily, these exercises can significantly improve strength, balance, circulation, and independence well into old age. If they can do it, so can you.